I was on holiday in Scotland and I was talking to a friend of mine whose mother had just recently had breast cancer. And when we went back to the accommodation we were staying in, I just happened to check and found like an indent. Thought, well, maybe it's my bra making a dent. Went without a bra for a couple of days, it was still there. So that was when I rang my doctor.
The surgeon will talk through the diagnosis and what the treatment options are with you. And then after the appointment, we'll take you to a separate room and we will go through any questions you have from that appointment. We'll go through your diagnosis again, and we'll go through the treatment options that have been offered to you.
We would have to look at what size the cancer is related to the size of your breast, and also whereabouts in the breast the cancer is. Your wishes are very important, and we would ask you what you would like and what your expectations are.
Any worries, queries, ask them. They are so patient and they'll always give you the right advice and be positive. And I know that's really easy to say because I've been there and I've come out the other end. But I think you've got to try and be positive and think, I'm going to be okay.
Pre-assessment clinic is the same for everybody that comes for a surgery. They'll be taking some blood tests to check for any iron deficiencies and things like that. They'll be doing blood pressures. They'll be doing an ECG, so looking at your heart, just to make sure that everything is safe enough for you to have the surgery.
The most important thing is that you've had a thorough conversation with the surgeon before your surgery. They will have explained all the risks, the complications, exactly what the surgery involves, and make sure that you understand all of that before you go ahead and give your consent.
If you have a mastectomy, we give you a prosthesis to go in your bra. We call it a softie. It's essentially cushion stuffing, so you get one size and you can remove the stuffing if it's too big, or you can add stuffing if it's too small. This can go inside your bra from the day after surgery, and it just means that from the outside world, no one will know you've had anything done.
For some patients, they'll need to come in and they'll have a small marker put into the breast so that the surgeons know where they're going to be doing the surgery.
That's something a bit like the kind of tag you get in the back of a library book that you can hear makes noise when we put a special device up to it. It's about the size of a grain of rice and we can put it in through a needle.
I also had a dye injected into me to see where that was going to go for the lymph nodes.
If the surgeon is planning to take any lymph nodes out, they want to know where the most worrying lymph node is. And in that case, you have a little injection just next to the nipple, just into the skin, so it stings a bit as it's going in, but that wears off quite quickly.
The surgeon can use a small probe that detects the radioactivity that we've given, and so that using the blue dye and the probe, they can see where the first node is.
Most patients, and that may include you, have day surgery, which means you come in quite early on the day of your operation and you go home later that day. A few patients may stay overnight, but most patients go home the next day if they do stay overnight.
So once you come into the day surgery unit, you'll be met by somebody there. They'll take you through to your bed space, give you a gown, some surgical stockings, get you all settled in there.
And then one of the other nurses came in to speak to me. I think she was from the breast team. With the little bag of goodies, there was a lovely heart-shaped cushion and some tissues and, a lip salve and a hand cream, just little bits just to make you feel a bit nicer. The cushion, it was fantastic because when I came home, because of the way you could sleep, you couldn't obviously sleep on your tummy, you couldn't sleep on your side, you had to sleep on your back. The cushion, because it was a heart shape, just sat nicely underneath and supported my arm, as well as not putting any pressure on anything else.
The surgeon and anaesthetist and the whole team will see them prior going to theatre. So we go through with them everything, and then obviously if there's a family member or like friends or relatives, we give them the phone number so they can ring us back during the afternoon or in the evening. So we keep them updated about the patients as well.
The informed consent is a process. You explain to the patient the diagnosis, the surgical options, the treatment options. You explain the risks and the benefits. Then they have the opportunity to speak, the patients have the opportunity to speak to the nurses once again to go through all of these things. And at any stage in that process, if they have questions, we answer them. And after they've got to the day of the surgery, you would expect that by then they've made an informed decision about what the risks and benefits are.
So then my name was called, I walked down to the surgery and I went into the surgery, into the pre-bit before you have, the operating room. He was lovely and chatty and jovial, made me feel really relaxed and calm. And then he put these big boots on me that were like pressure to stop thrombosis. And then the anaesthetist spoke to me and said, right, you'll feel a cold sensation going into your arm. I'll count you back, and then the next thing I was gone.
There are 2 different types of operations that we offer. We either remove part of the breast or we remove all of the breast, which can be combined with breast reconstruction. In terms of operations in the armpit, we either do a small operation called a sentinel lymph node biopsy. If the lymph nodes didn't look normal and we performed a biopsy of your armpit and that armpit showed cancer, then you would be recommended an operation called an axillary lymph node clearance. When you're still asleep under the general anaesthetic, after the operation, you're taken round to what we call the recovery bay, and then you have your own nurse looking after you as you wake up from the anaesthetic.
The next thing I knew, I woke up in the recovery room. There was a nurse sat by me. I sort of looked over to her. She looked at me and she said, "Are you okay?" And I went, "Yeah." And I just put my hand out and grabbed her hand and just held her hand. She said, "Do you need some painkillers?" And I just thought, well, I feel okay now. And I said yes, because I thought if I then later on I just say no, I'm fine, and then it becomes really painful, it's too late for the painkillers to kick in.
We do say that to take your pain relief regularly. You're generally given paracetamol and ibuprofen, and they are enough to cover pain. If you are worried that you're going to experience more pain, you can always ask the surgeon on the day.
A lot of patients find that the pain under the arm is more troublesome than the pain in the breast from when they've had the lymph node surgery. And so if that is the case for you, then obviously just take painkillers as and when you need them.
It was just uncomfortable and sore. I don't recall it being painful as a pain like if you break your leg or break your arm or something. It was just sore.
Wounds are closed with stitches underneath the skin. They hold the wound together. The glue on top of the skin is just sealing the edges of the wound. The glue will start to flake off in around 7 to 10 days. It looks like dry skin, but please don't pick at it. It will fall off naturally when you're showering and using the soaps. It just means it's done its job.
When the patients are ready in the recovery, one of the recovery nurses will contact the day surgery ward. So we go and collect you ourselves in the recovery, and then we make sure that you're comfortable and then ready to come back to the ward, like awake enough to come back to the ward for food and drinks. We check the wound every hourly, make sure the wound, there's no bleeding or hematoma or nothing like that in the wound. Sometimes it's quite normal for the patient to feel a little bit sick as well because of the anesthetic. So if you need any anti-sickness, or we call it antiemetic, we give it to you.
They took me back to my room. I fell asleep. Then the consultant came round just to see how I was doing.
We do look out for things called seromas, which are build-up of fluid. This tends to generally be our mastectomy ladies. If it stays nice and soft and you can feel it moving around a bit like a hot water bottle with water in, then we like to leave them and your body will reabsorb that fluid. And if it becomes hard, hot, or you're worried about it at all, just get in touch and we can see you and we'll give you some reassurance.
And they brought me around something to eat and drink, and then once I could do the obligatory toilet and have something to drink, they then said, right, 5 o'clock, if you want to go, do you want to ring your husband and he can come and pick you up? So then my husband came to pick me up and I went. So it was literally from morning to night, it was all over within a day.
Once you're ready to go, we can let your family know and they can obviously come and pick you up. And that may be late on into the evening. A lot of patients do ask what time is the sort of cut-off, and we do have patients going fairly late on into the evening, sometimes 8, 9, 10 o'clock if it means that they can get home the same day. Some patients can experience some funny feelings underneath the arm after their surgery, and that's related to the lymph node surgery. If that happens, you can take some pain relief, or just gently rubbing the arm is often quite helpful just to help to ease that sensation. Usually passes in a few months after the surgery. It's nothing to worry about, it's just part of the anatomy of where you've had the surgery done.
The main things that people can develop after surgery is bleeding and infection. Bleeding tends to happen the first few days, but sometimes it can happen even a couple of weeks later. An infection normally doesn't develop for at least 7 to 10 days, if not a bit longer. And at that stage, you're looking for maybe a bit of redness, the breast get increasing tenderness, maybe the wound start weeping, which they hadn't been doing before. The main thing is if the patients have got any doubts or any concerns, they can contact the nurses.
You can shower from the day after your surgery. It is important that you use soaps. Don't use a flannel or a shower scrubber on the area because you will scrub the glue off. We just want you to use soaps on your hands, rub the areas and rinse off the soap suds thoroughly. But it is really important that you shower after your surgery and use soaps. Any soaps is fine, any soaps that you normally use in the shower.
I was conscious that when I did have a shower, I didn't let the water fall directly on it because it felt like needles. But other than that, yeah, it was fine.
Your breast nurse will call you a couple of days after your surgery just to check in, see if you've got any questions. Your follow-up appointment will be about 3 weeks after your surgery. That will be with the consultant that's usually done your surgery. They'll have the results from the histology, so everything that we have removed. This will tell us how big the cancer was, how many lymph nodes were involved, if any. And this will then tailor the treatments after your surgery, so things like hormone therapy, radiotherapy, and if chemotherapy is something that you would need.
The surgeon who did the operation just said, after your operation, we've done the tests on it, we're 100% sure that we've got it all out, it's all clear, it's fine. Oh, what a relief, you know, after all that wait. And then I think about a month after that, I had my first consultant who just spoke about, you know, how sick the hangs were going, just checked on the scar, checked on other tissues and under my arm and everything. And it was at that point that I went into the hospital that it really hit me, because I went into there and walked in and sat down and she said, "How are you?" And I just burst into tears. And I said, "I'm really sorry." And she said, "No, it's not." I said, "This has just brought it all home." It all came tumbling out, and all the emotion of what went on over the past, you know, few weeks just all came out. But it was, again, she just sat there and she listened. She said, "It's not a problem." She said, "You know, what you've been through is quite traumatic." And she was lovely.
We say not to drive for 2 weeks, and you have to inform your insurance company to update your policy. You can't do any housework or heavy lifting for the first 2 weeks at least.
At the time, it did feel really slow. I was thinking, oh gosh, is it always going to be like this? Is it always going to look like this? And then you forget, and then you look and you think, oh, it's gone. You know, the scar is almost healed. You know, it's almost gone.
If you have a wide local excision or a therapeutic mammoplasty, so breast conserving surgery, we do advise you to wear a bra day and night for 6 weeks, because that also acts as a pain relief.
I wore a bra at night, I got a comfy bra at night, and I wore a supportive bra in the day. It's only recently in the past month that I've gone back to underwire bras, because I was thinking, I don't know why, it's mostly not relevant at all, but I was very conscious of having that wire by it.
The more surgery we do to the armpit, patients are more likely to get shoulder stiffness. That is why the physiotherapy is really necessary.
I had a set of exercises to do every day, morning and night, which they recommended to do, and they were really easy. Literally take less than 10 minutes, which meant that then I didn't have any complications later on from cording or my arm being stiff or having movement that I couldn't move about.
The exercises are beneficial for multiple reasons. They reduce shoulder stiffness, they reduce the cording, so the tightness of the tendon, but they also do help with the build-up of the fluid, because your lymphatic system is just underneath your skin. So these exercises are really gentle and they just help the lymphatic drainage from the breast. If you start to build up your activity and you feel anything pulling or you feel it's painful, just stop. Again, you're always welcome to call us and we can talk through that activity and how to adapt it to your needs.
Think about what works for you in terms of your normal support. Use your family or your friends, or it may be that you find it helpful to talk to someone completely separate from the people closest to you. So that might be us in the breast nursing team, might be someone at Maggie's, it might be a phone call to someone at Macmillan, whatever works for you.
You do think, well, what if it comes back? You know, what are the chances of it coming back? And I think that will always be there. I think you'll always have that shred of doubt.
Everybody who has an operation for breast cancer will then be recommended to have a follow-up mammogram, and that mammogram will take place once a year for the next 5 years, and in younger women we'll make sure you have a mammogram every year until you're 50.
Give yourself time and be kind. Be kind to yourself. Your body has gone through a lot. Just be kind to yourself.
It's a scary time, It is, and it can be a very lonely time, but it's knowing that we're here for you. If you have any question at all, no question is a silly question. We get that a lot. We've heard it all before. Please do not hesitate to get in touch. That is what we are here for. We're here for you through this.
Although this is a very big thing in your life, it's something that we've seen many times, so we know what works and we know how to treat you well.
The care that I had at the church was been out of this world.